Good evening, sir.
Good evening. How
Good
was
evening,
your
sir.
morning?
Very much stressed, sir.
Stressed?
Yeah, I
Okay,
mean,
why
I
is
was
that?
I was stressed last night, so
Ah,
I woke up late, and unless Megha was there to remind me, probably I would have missed the exam.
oh
So I
dear.
started half an hour late and could not finish full set of
Ah,
questions.
okay. But anyway, you can make up now.
Okay, sure, sir.
Right. So, in the last few classes, since the last
Yeah,
exam, we have only covered two topics. One is
yeah.
neurobiology of autism, for which you also have the reading material and the videos that you have seen, or referrals, which we have discussed before also, but we have covered in detail this time.
Yeah.
So there will be two questions, one on neurobiology of autism, another will be on referrals. So my first question is on neurobiology. So in neurobiology of autism, there are specific mm, patterns of neurological um, derangements in autism in two different age groups. One is a toddlers group, early years group, another is an adolescent group. So can you discuss the difference and similarities between the two?
In both the conditions, the thing is deficiency of connection or synaptic connections. In 2 to 5 years age group, the deficiency is mainly in the areas of the corpus callosum and also in the corona radiata area. And later on, the insula and the amygdala becomes very important. And these two areas develop increased local connection and deficiency of remote connections. Sir,
Apart from the connections, what are the specific areas do you think are involved in early stages as opposed to the late stages?
the cortical areas as such,
Where are they affected? Where are they not affected?
they are affected in the prefrontal cortex and the insula.
Which age? Both ages? Is that a
Uh,
similarity or difference?
there is a difference,
Okay.
and these areas are mostly involved in the adolescence
Okay.
and in the initial ages, it is the I mean white matters coming from the cerebral cortex, which are mostly involved.
Okay. Right. So, what happens with neurobiologically? What happens with the language?
Language development is delayed.
Why?
That I cannot make very
No,
clearly right now.
neurobiologically. Neurobiologically?
Language development depends on the sensory inputs and processing. So, in this case, in particularly in autistic children, the sensory input is explained in a or interpreted in a different way, and that different way of interpretation gives rise to different way of response, and that is basically the root cause of delayed language development, because right language is not being input there.
Okay, sir. Now, my next question is on referrals. Okay.
Yes, sir.
So, you are a pediatrician. You are seeing a child with suspected neurodevelopmental condition. You want to refer. Okay. I want you to just bullet point the skills you will need. These are the skills I will need to make a referral appropriately and successfully.
Yes.
Okay, sir.
First of all, my clinical knowledge about any neurodevelopmental disorder, because what I do not know, I cannot see. So, with my clinical knowledge, each and every patient I see, for whatever be the reason, I look for any developmental delays or developmental disorders. And if anything appears to be suspicious to me, I check it from the parents. And if they also nod their heads with me, I just explain them that this thing is not normal. Maybe it is not causing any serious problem right now that you can see, but later on, it will be a challenge with the child for his or her future development. So it
So you have
must be,
clinical knowledge, you are actively looking for signs, you are
yeah,
involving parents and you are explaining what other
yeah.
skills do you need.
And then I will advise I will first make one initial assessment myself with my clinical knowledge whatsoever I have. And I will uh, decide then the patient may have this and this and this. So it should be properly assessed by one developmental pediatrician. So I will suggest the parents to uh, go and do an assessment properly, to visit one developmental pediatrician and do one assessment, and of course at the same time management of the situation so that it can be solved as early as possible. At the same time, I will also highlight one thing, few words at least I should say. This is the, if the child is below 5 years of age, at least I will say this is the right time to intervene. And if we just follow the wait and watch policy, that may not be good for the child. So I will advise you to do whatever is necessary, as I am suggesting you, at your earliest convenient time, because this is right time for intervention also. That can solve the issue.
What other skills do you need?
People skill, talk to the parents and make them understand that this is a problem for whole life.
Acha, people skill is one thing. Any other skill?
So I can say.
No problem. Dr. Bhakta, you had a tough day.
Yeah.
We had a tough
Still,
day. Mega had a tough day. So
yeah,
thank you.
welcome, sir.
See you next.
Thank you, sir.
Bye bye. Good night.
Good night.
Bye.